Hiya, Carol. Now, Carol, would you just like to introduce yourself? I know you've done some of this information cast before, but to those people who might not have heard it, just introduce yourself and your role and background.
Yeah, sure. So I'm Carol Keane. I'm a physiotherapist and I work as a specialist therapist in pulmonary hypertension at Sheffield at the specialist centre there. I've been in that role for about 3 years now, and my focus in that role is seeing patients, talking to patients and helping them in becoming more active and looking at the ways that we can promote exercise activity in patients with pulmonary hypertension. So that's the focus of my clinical work, and I'm also doing a PhD, doing some research alongside that, looking at the same things. So that's what my day job is. Through the COVID pandemic, I've taken a step back from that role for a few months. Been back in a more ward-based role and supporting teams in the hospital, providing respiratory physiotherapy to patients, including patients with COVID. And now as things are quietening down in the hospital from the COVID point of view, I'll be back in my pulmonary hypertension role in a couple of weeks, which I'm really, really looking forward to. And I think it's going to be quite an interesting time going forward.
Mm-hmm. Okay, so what might be helpful, Carol, rather than talk specifically at this time about activity and exercise and I'd like to just understand from your perspective, your expertise about how people might sort of psychologically and mentally sort of feel about activity and movement, particularly those who are having to shield, etc. What's the best, do you think, approach to this?
I think it's really, really challenging, isn't it? Because there's lots of advice around, there's lots of information about, there's lots of, in some ways, lots of pressure around. We've got to be active, and an emphasis from the government on rightly, on the importance of exercise and the importance of well-being. And I think it could feel a bit overwhelming for people. So I think maybe the best place to start might be just to take a little bit of a step back from it and ask yourself what is important in your life and what are your priorities and what are the things that matter most to you.
Is there, again, digging into your expertise here, Carol, because we're talking about activity, fairly strong evidence or not, that being more active has a positive effect on your mental, emotional well-being? Is that strong?
Yeah, there's loads and loads and loads about. So we talk about exercise endorphins, so endorphin is I suppose you could call it your happy hormone, which your body releases when you're feeling good, when you're feeling happy, and you get that kind of, oh, that was great. So laughing, smiling, all reduce positive endorphins, spending time with people, being in social situations, loads and loads of things can release positive endorphins. And I guess we've all been a bit short of those through lockdown. And exercise is something else that can produce endorphins and give you that sort of happy feeling. So apart from the physical benefits of it, we know that it has really good benefits. It's been shown to be helpful in managing stress and anxiety, and managing mental health conditions like depression, and even where those aren't present, it can just sort of generally give a feeling of mental wellness. And then being outdoors does the same. So if it is possible for you to combine your activity or your exercise with being outside, then you kind of get a double bonus as well. So if you can, even if it's just taking a walk around the garden, because there was Captain Tom, wasn't there, who walked up and down the garden however many times. So, even within some relatively small confines, it is possible to get outside and to get exercise. And so if you can combine it with being outside, then that gives you an extra effect. I know that in the last week or so, advice around shielding for those people who are shielding has changed, which has suggested that if you are shielding, you are okay to go out, or it is possible for you to go outside and spend some time outside, and then also if you're living alone, to meet with somebody from outside of your household. So that seems like a great opportunity if that's what would work for you, to maybe take a walk. Whether that's a walk down your street, a walk around the block, a walk in the countryside, a walk with somebody, all of those things are things that are going to make you feel better physically and mentally as well.
And as you already said, this is about it's recommendations. It's not the law. You've got to do this. But
No,
some
absolutely.
people, we will all assess risk differently, won't we?
Yeah. And I think that goes back then to what matters to you, isn't it? Because if what matters to you is about minimising your risk of catching COVID, and you see that staying inside is the most important thing, then that might be the choices that you take. If what matters to you is being part of your wider family group, then going out for a walk with a family friend or with a relative can be important. It just is going back to thinking about what matters to you, looking at the advice that's around, and then marrying them up together. And deciding what steps you're going to take towards achieving that. But knowing that being outside is really good for you, taking a little bit of exercise is good for you, and doing things bit by bit is a good way to approach change.
Good. So, Carol, just to conclude this now, because I think we've covered quite a good amount of issues that people have asked us about and are asking on Facebook pages and things like that. If you were to sum up now in a few sentences, take away messages around the very things that we've talked about, how would you do it? Either 3 points, or how would you like to conclude that with a takeaway advice?
I would say have a think about what matters to you. If exercising or being a little bit more active is going to be part of that, then a good way to approach that would be to take small incremental steps towards it. Increase what you're doing bit by bit. Be guided by breathlessness. So exercise to the point where you're a little bit out of breath, but you could still chat is a good level of exercise, and just keep monitoring how you are. Be kind to yourself. If it's not a good day for you, if it's not an exercise day for you, then don't do it. Pick a day that is, and if things aren't going according to plan, then be kind to yourself and just take a step back and reshape your plan.
Excellent. That's really good, Carol. It's very helpful. I've either learned quite a lot, or you reassured me quite a lot. As I say, it's about being kind to yourself, isn't it? And good days and bad days, and responding to those. So really good to speak to you, Carol, and look forward to coming back into working in PH and
It'd be lovely.
Back to some degree of normality, very
Possibly.
very slowly. Yeah.
Take care. Nice to talk to you. Bye bye.
Andrew. Bye.